Dr. Gary Bellman, microdosing. Microdosing is all the rage with regard to doing shots more frequently. What is microdosing about? Well, microdosing is basically trying to do, instead of an injection, for instance, once a week, to do it more frequently. Why would you want to do it more frequently? You'd potentially want to do it more frequently because after a shot, most medicines peak and decay or lower their concentration. And instead of doing a shot once a week, you can do a shot twice a week, 3 times a week, even daily. So this applies to both testosterone replacement and as well as GLP-1s like Ozempic and Mounjaro. So this is a graph of a testosterone injection. So the testosterone injection, after the injection for the next day or 2 or 3 peaks and then decays towards the end of the week. So what should you do? If you do a testosterone injection once a week and you feel fine over the course of the week, then do an injection again the second week, and you don't have to poke yourself, pin yourself more frequently. However, if after 3-4 days you notice you don't feel as good, then take that dose and break it in half and do 2 injections. Some people do 3 injections. And it's really about how you feel. So if you feel just as good throughout the week, even though the levels of the medicine in your body decay, don't give yourself another shot. The same applies to your Ozempic and Mounjaro. The manufacturers of these drugs have made it such that it'll stay in your system for the duration of the week. However, the levels will be lower. So the same with your GLP-1s. If you feel that it curbs your appetite through the week, then just stay on a weekly shot. If, however, you feel that the effects are more pronounced or more prominent earlier in the week and they decay, and on day 4 or 5 you're craving food more, then take that dose and break it in half and do 2 shots a week or even 3 shots a week. So microdosing is not for everybody. If you're doing weekly shots of testosterone or weekly shots of your GLP-1 and it's smooth and the effects of both are consistent, don't poke yourself again. However, if you do feel it falls off, microdosing, 2 shots a week, 3 shots a week, some people take it to another level and do daily shots. Microdosing may be for you if you feel that there is a fall off in the effect of the medicine.